Hi there, Duncan here, physiotherapist and owner of Life is Movement, here with another exercise video demonstration. I make these videos for my patients here at the clinic. However, if you're not a patient and you find any of these valuable, please feel free to use them as you wish. Just please make sure you do so safely. So I'm here with Julian, who is making excellent progress with his back issue. And I wanted to demonstrate an exercise that is really, really important as a sort of mid to even later stage exercise to continue to improve and regain your spinal flexion pattern. Spinal flexion is the ability to sort of roll forward and touch our toes. Really important for a healthy functioning spine, and also important for just functionality, you know, to bend forward and pick something up, do our shoes, do our socks, that sort of thing. So in my experience, most people with back issues, particularly anything that might be disc related, spinal flexion tends to be the biggest struggle. So what I'm going to do is talk Julian through a way to continue to regain this pattern once we've finished doing the floor-based and sort of quadruped-based exercises like the pelvic tilting and the rocking exercises. So as you can see, Julian is sitting on a box. He's on a 20-inch box, and he's also sitting on a bumper plate, which is about 2 inches. Julian's quite tall. But you do ideally want your hips above your knees for this exercise. And as you can see from the video, Julian's hips are sitting just above his knees, which is right. And what I'm going to ask Julian to do first is to can you relax your head down? Beautiful, like really nice and gentle. Now, not for Julian, but for some people who have a really, really acute disc issue, even doing this can be a little bit irritating. And if that is you, stop here. This is your first step. Once you get comfortable with this, you can move to the next steps. So the next step is, Julian, I'm just going to ask you to slump your shoulders forward. Exactly. So as you can see in the video, we're starting to get spinal flexion from the cervical spine first, and now we're starting to flex into the thoracic spine. This sequence of steps is really important because we want to be rolling the spine down rather than just sort of flopping down and see what happens. Now what I'm going to say to Julian is I've put lead weights into your hands, into your fingertips. So you've got really, really heavy, heavy fingertips. And I'm going to ask you to allow those fingertips to draw you down towards the floor. Nice and slow, nice and gentle. And obviously, if this is you doing this, as soon as you start to feel some resistance, discomfort, stop. That's as far as you're going today. But as you can see, Julian has made fantastic progress, and he can sort of keep going and going until not just his hands are on the floor, but he just keeps going until he's comfortable. Julian, any pain at all? No. Excellent. Any tightness?
Tiny little bit, very bottom of the back.
Okay. And as you can see, we've got a lovely, and Julian, you'll see this in the video, really fantastic curve of the spine here, which Julian wasn't getting when he did this same movement in the standing position. So we're using this exercise to retrain the body. Now, if you want to get a little bit further, I'm going to say to Julian, take a nice deep breath in, particularly if you can breathe into your lower back. And as you exhale, if your body wants to sink at all, allow it, but never force it. Yeah, excellent. As you can see, excellent range of motion. And then to come up, this is really important. I'm going to ask you to think of the midfoot on both feet. The midfoot is like where your shoelaces would be if you're wearing shoes. And I want you to push down into the floor to come up. So we're not thinking about pulling up from the lower back. We're pushing down into the floor to come up. Go ahead, Julian. Yeah, and as you can see, that's really excellent. By thinking of pushing into the floor with our feet, we're activating the muscles of the posterior chain, which are the big, strong muscles designed to create the movement. We're not going into the lower back, which is sort of not necessarily designed to hoist all that weight, particularly if you've got a lower back problem. So by just thinking about that different cue, pushing down to come up, for those of you who struggle, who get pain or discomfort in coming up from flexion into sitting or standing, that should really, really help sort of change that neurological pattern and reduce the pain. Really, really good, Julian. That is the seated flexion pattern exercise. Give it a go.